Hi and welcome. Let's briefly look at the indications for lumbar puncture. So, lumbar puncture, also known as spinal tap, is a diagnostic and sometimes therapeutic procedure in which cerebrospinal fluid, also known as CSF, is collected from the subarachnoid space, usually between L3 to L4 or L4 to L5 vertebra. So we have diagnostic indications for lumbar puncture. So lumbar puncture is performed to analyze cerebrospinal fluid in suspected diseases affecting the central nervous system. It could be infectious diseases such as meningitis, it could be bacterial, viral, fungal, or tuberculous meningitis, encephalitis, neurosyphilis, or CNS abscess or parasitic infection. Can be also used to assess subarachnoid hemorrhage. When CT scan is negative but subarachnoid hemorrhage is still suspected. It can be used to assess demyelinating diseases such as multiple sclerosis to detect oligoclonal bands. To assess Guillain-Barré syndrome, here is to check for albinocytologic dissociation. It can also be used to assess malignancies such as leukemia or lymphoma with CNS involvement. That's for diagnosis or staging. It can be used to assess autoimmune/inflammatory disorders such as sarcoidosis, lupus cerebritis, or other central nervous inflammatory conditions. The therapeutic indications for a spinal tap are to relieve intracranial pressure in idiopathic intracranial hypertension. It is idiopathic in the sense that the source or etiology of the hypertension is unknown, and it is also referred to as pseudotumor cerebri. It can be done to administer intrathecal drugs such as chemotherapy, e.g. methotrexate and cytarabine, antibiotics, especially those used in treatment of meningitis, anesthetics, especially spinal anesthesia. So what are the monitoring indications of a spinal tap? This is to measure cerebrospinal fluid pressure in conditions like hydrocephalus or intracranial hypertension. So in summary, when you think of a lumbar puncture, that's the indications, you should think of LP tap. L is look for infection, it could be meningitis or encephalitis. P is for pressure measurement/relief, that's in intracranial pressure or pseudotumor cerebri. T is for therapeutic, that's drug administration. A is for autoimmune or demyelinating disease evaluation. P is for presence of blood, that's in subarachnoid hemorrhage diagnosis. So whenever you think of indications for a spinal tap, you think of LP tap. Thanks for listening.